Hello, I am Dr. Hussain Iqbal. I am an orthodontist and dentofacial orthopaedist. I am a smile design specialist working with COSMODENT India, Frazer town, Bangalore. The gum surgeries, also known as gingival flap surgeries, are surgeries, minor surgical procedures that are done to reflect the flap, the gum, slightly away from the tooth and to have a direct access to the roots of the tooth, so that whatever infection or inflammation or a foreign body that may be present in that region that may be causing the recession of the gum or destruction of the bone in that region can be addressed. So that is what a gum surgery is. It may be needed for individuals with either mild to moderate or maybe for aggressive kind of periodontitis. Periodontitis means the structures that are surrounding the tooth are infected and inflamed. It's not just about the gums being affected, it can be the bone underlying the gums that may have a bone disease that needs to be addressed. So that is why a gum surgery may be required for such individuals. But before starting a gum surgery, a periodontist usually does a general round of cleaning for the teeth, which in dental terminology is called ultrasonic scaling. That means with an ultrasonic device, we remove the layer of plaque and tartar, also called calculus, from the tooth surface. We go above the gums and slightly below the gums without having to reflect the gums down. So that is a preliminary procedure that is followed before starting a gum surgery. And after such a round of cleaning, supragingival and subgingival, we give some time for the patient to heal and see what is the effect of this procedure before going into more invasive gum surgeries. Gum surgeries, if required, can also be used along with other adjunct procedures like osseous surgeries, that is bone surgeries. So what is the procedure about? Now the periodontist or your oral surgeon or the dental hygienist at times, they reflect the flap. They first numb the area so that the patient is quite comfortable throughout the procedure. So as a general belief says that the gum surgeries are slightly painful, it's a myth. There's nothing like that. Usually the areas are made numb. A shot of anesthetic is given before starting the procedure, and usually gum surgeries are addressed quadrant wise. That means if you divide your entire mouth in 4 quadrants, each quadrant is addressed at a time. So it's a short procedure, usually takes around half an hour to 1 hour. The area is numbed first, the flap is reflected, a thorough round of cleaning is done below the gums where the roots are there. It's called root planing. So after having cleaned the roots of the teeth of whatever infection exists, whatever bone infection or the bone defects that may be visible there, after cleaning everything, a round of direct medicines are spread in that region. It's called local drug delivery, and after that the gums or the flaps are sutured back again. The patient asks us about the discomfort that they may experience after the gum surgeries. So mild to moderate discomfort may be there after the procedure, as the body is in a healing phase, and because it's your mouth, it's a sensitive area, so mild discomfort is definitely there. But the periodontist will prescribe you with pain medicines that are available over the counter, so they can be taken and the pain can be dealt with that. Other than that, there is hardly anything that one should be worried about. Most important part is the maintenance after the surgery. So as with the natural teeth, as you maintain your teeth daily, here you have to be a little extra careful and take a step forward to give additional attention to the kind of cleaning that you do. So regular toothbrushes, maybe 2 to 3 times a day with a soft bristle toothbrush. Sometimes you can use a motor toothbrush also in the areas where a gum surgery has been done, and especially if a periodontal pack is not given, that means a Coe Pack or something that is to cover the gums after the surgery, if that is not given, then extra care has to be taken. So antimicrobial rinses like a mouth rinse with chlorhexidine in it can be used, and with a finger with gentle pressure on the area where the surgery is done, that can also be used to remove any layer of plaque depositing in the area of the surgery. Basically, the intention is to keep the area clean as possible so that no bacterial colonies start forming in the region. One may also come across slight swelling after the surgery for the next 2 days, but that is quite usual because a surgical insult has been done in the region and the body takes time to heal. So it's a part of the healing process. If that happens, the painkillers that are usually given has an anti-inflammatory factor in it, which helps to deal with the healing also. And after gum surgeries, usually the swelling is not so much. An ice pack can be used in those regions where a surgery is done, and that usually suffices. If the swelling is more, you can definitely contact your clinician, your periodontist or the oral surgeon to get to know if it is normal or not. If the swelling continues even after 48 hours to 60 hours of the surgery, then you must call your periodontist, because it might be a sign of some kind of infection happening in that region. So pain and swelling even after 48 hours to 60 hours, call your clinician.